It may sound like something out of a sci-fi movie, but superbugs could soon become the #1 cause of death, even over cancer.
Here with more on this topic and what's being done to manage some of the illnesses is OSF Healthcare Director of Physician Practice, Dr. Brian Curtis. Now, this is something I know me and Mark didn't really know much about, but it is concerning when you break down some of the numbers.
Yeah, it's very concerning. So when you look at the number of deaths caused by resistant bacteria last year was over 22,000 people. And so it equates to about over 2 million illnesses a year and over $2 billion of cost to the U.S. healthcare system. So it is a very big problem that we have out there.
So just to clarify, when we talk about superbugs, we're not talking about giant mutated creatures. No. What are we talking about?
So we're talking about bacteria that are resistant to an antibiotic or multiple antibiotics. And the way they become resistant to it is they're exposed to an antibiotic. And so that's why physicians and APNs and PAs are so forceful in regards to proper antibiotic usage for people. So if your doctor tells you you don't need an antibiotic, you probably don't need one.
I mean, when you break that down, it's interesting because we were just talking about how, you know, people don't really think twice when it comes to antibiotics, but they may have other questions when there's other medications involved. So how can they go about, you know, managing that a little bit more responsibly?
Sure, I tell people that you're a consumer within your health care, and so you are an active participant, and so you would never go buy a car and just walk off the lot with whatever car they gave you. And so you really need to participate within your health care. And so when you're managing your cholesterol, your blood pressure, exercise, whatever it is, you need to participate. So if you're going to go on an antibiotic, you need to treat like you would any other medication. Do I really need to take this medication, or is there another alternative for me to be able to do that so I don't have to take an unneeded medication?
Do you think sometimes doctors may prescribe an unneeded antibiotic just to quote unquote shut the patient up, make them feel better? I mean, maybe even as a placebo effect?
Yeah, well, I think that we talked earlier that, about 30% of antibiotics that are prescribed are unneeded. We know that. And there was a study out of Europe that says 60% of healthcare providers felt pressured to give an antibiotic when they knew it wasn't needed. And I'll tell you, I think that number's low because I don't have a friend in the world that has not been pressured at one time or another to be given an antibiotic that they knew was not needed.
So are there lifestyle changes, dietary changes that may supplement some of those things, or what can you think of?
Keeping yourself healthy, like we always talk about, exercise and diet, and the other one is really getting serious about immunizations. I know we talk a lot about it on the show, about getting your flu shot, but there's the Pneumovax to prevent pneumonia. We know the Prevnar in children has shown decreased incidence of ear infections and pneumonias, and that has actually translated to a decrease in adults. And so really, if we have an ability to immunize a population, we need to get serious about it. 60,000 people, 80,000 people died of influenza or influenza-related illnesses last year, which some of those are secondary bacterial infections that they got because their immune system was overwhelmed. So if we can immunize somebody to prevent them from going on an antibiotic, we really should.
A lot of very good things to think of, and we appreciate you breaking it down for folks. Of course, we'll share this interview over on our website. Just head on over to ciproud.com and click on the Good Day Central Illinois tab.